Hi, I'm Malavika, and in this video, I'll be explaining the evolution of morphological changes in myocardial infarction. So in the first 30 minutes, there are no visible growth changes or light microscopy findings, but on electron microscopy, you can see three things, namely relaxation of myofibrils, loss of glycogen, and swelling of mitochondria. Now all these three things are characteristic of reversible cell injury. So in the first 30 minutes, there will be reversible cell injury. Now, half an hour to 4 hours, again there are no growth changes. On light microscopy, you can see wavy fibers. And on electron microscopy, you will be able to see mitochondrial amorphous densities. Now, this is characteristic of irreversible cell injury. So from here onwards, irreversible cell injury occurs. Next is 4 to 12 hours. There will be occasional dark mottling. It is not that evident, but it may be seen. And on light microscopy, you can see early coagulative necrosis. Now 12 to 24 hours, dark mottling becomes evident. Then we have again coagulative necrosis continues. There will be increased eosinophilia, beginning of neutrophilic infiltrate and pycnotic nucleus. 1 to 3 days, there will be mottling with a yellow tan center. Coagulative necrosis will continue. Neutrophil infiltrate will increase and there will be loss of nuclei and striations. 3 to 7 days, there will be hyperemic border with central yellow tan. On light microscopy, you will be able to see disintegration of neutrophils and cardiac myocytes, and the macrophages will engulf the dead cells. 7 to 10 days, it will appear maximally yellow tan in color and it will also be soft. Phagocytosis of dead cells will continue, and also there will be deposition of granulation tissue, which is basically deposition of new connective tissue and blood vessels, and they will replace the infarcted tissue. 10 to 14 days, red-gray depressed infarct borders will develop. Granulation tissue will become well established, and there will also be collagen deposition. So that happens on the 10th to 14th days. Then we have 2 to 8 weeks when there will be development of a gray-white scar. Collagen deposition will be increased and also cellularity will be decreased. More than 2 months, scarring will be completed and there will be development of a dense collagenous scar. An infarcted area becomes grossly visible by around 12 hours, around this time. So, how do we detect an infarct that started, suppose, 2 to 3 hours before death? That is when we use something called TTC, or triphenyl tetrazolium chloride. It imparts a brick red color to the non-infarcted zones, while the infarct will appear pale in color. This is because dehydrogenase enzymes like lactate dehydrogenase are still active in normal non-infarcted areas. Lactate dehydrogenase will reduce TTC to produce a red colored pigment. Whereas in infarcted areas, dehydrogenase enzymes would have already leaked out of the cells due to the damaged cell membrane. So this reaction cannot be seen in infarcted areas. So that was all about the morphological changes in myocardial infarction. Thank you for watching.